Welcome to Heart Attack Awareness. If you're over 40 or know someone who is, today's episode could literally save a life. But before we dive in, I need to ask you for something important. Please take a second to subscribe. Each week, we bring you practical, science-backed strategies to protect your heart, detect danger early, and avoid being caught off guard by a sudden heart attack. If you find this video helpful, subscribing helps it reach more people who might need it just in time. Now, on to one of the most urgent questions in heart health. Can you spot a heart attack before it happens? And if so, how early? The answer may surprise you. While Hollywood would have us believe that heart attacks are sudden and dramatic, often striking out of nowhere, the reality is far more subtle and far more dangerous. In fact, in many cases, your body gives you warning signs days or even weeks before the actual heart attack occurs. The problem is that we don't always recognize them for what they are. We explain them away. We say we're just tired, or we blame that strange pain on indigestion or stress. But in the 72 hours leading up to a heart attack, certain signs become increasingly common. Learning to recognize these signals could mean the difference between survival and tragedy. Let's begin with the most common and most ignored early warning sign: unusual fatigue. We're not talking about normal tiredness after a long day. This is deep, persistent, whole-body fatigue that feels different than usual. It may come on suddenly or build up over several days. In studies, over 70% of women who suffered heart attacks reported unusual fatigue in the days or weeks beforehand. For men, the number is still high but less reported, likely due to differences in how symptoms are perceived and discussed. This fatigue occurs because the heart is struggling to pump blood efficiently. Oxygen delivery to muscles and tissues is reduced, making simple activities feel exhausting. You might find yourself winded after walking upstairs or unusually wiped out after doing routine chores. Pay attention to this. It's not normal aging, it could be your heart asking for help. Closely related to fatigue is the next sign: shortness of breath. Again, not just when exercising, but during rest or mild exertion. If you suddenly find it harder to catch your breath, or if you're breathing heavier doing tasks that used to be easy, this is a red flag. When arteries are blocked, oxygen delivery is compromised, and the lungs often pick up the signal before the heart screams in pain. Another early clue: sleep disturbances. This is an underappreciated sign. Many people who go on to suffer heart attacks report disrupted sleep in the nights leading up to the event. This may include difficulty falling asleep, waking up gasping for air, restlessness, or nightmares. It may be that the body is subconsciously sensing distress and struggling to stay in a restful state. Chest discomfort, as you might expect, is a classic symptom, but it often doesn't show up the way you think. It's not always crushing pain. It can be a tightness, pressure, burning, or heaviness that comes and goes. This discomfort may radiate to the neck, jaw, shoulder, or arm, particularly the left arm, and can last minutes or fluctuate throughout the day. Some people describe it as feeling like an elephant is sitting on their chest. Others say it feels like heartburn that just won't go away. What's crucial to understand is that in the days before a heart attack, this chest sensation may not be intense. It might be subtle, but it's still a major red flag. Next, digestive issues. Believe it or not, indigestion, nausea, stomach pain, or vomiting can be early signs of a heart problem, especially in women. That's because the nerves that signal pain from the heart overlap with those from the stomach and esophagus. If you suddenly start having upper abdominal discomfort, particularly if it comes with cold sweat, dizziness, or breathlessness, you need to consider that it may be your heart, not your gut. Back or jaw pain is another sign that confuses people. It's often chalked up to muscle strain or dental issues, but referred pain from the heart can manifest in these unexpected places. If you feel pressure or pain in your back, neck, or jaw, particularly in combination with fatigue or shortness of breath, take it seriously. Anxiety or a sense of impending doom is a powerful signal. Some people report feeling like something isn't right or having a deep sense of dread in the days before their heart attack. This isn't just fear, it's a visceral, gut-level awareness that something is wrong. It may be your nervous system picking up subtle changes your conscious mind hasn't yet identified. Let's put this together. If, over the course of a few days, you start experiencing a combination of these symptoms, unusual fatigue, breathlessness, vague chest discomfort, sleep problems, or digestive distress, don't ignore it. These signs may not feel like an emergency yet, but they could become one very soon. Now let's go deeper into the timeline. In the 3 days before a heart attack, symptoms often ramp up. On day 3, you may feel more tired than usual. You might blame it on poor sleep or stress. By day 2, you might start noticing breathlessness walking to the mailbox or doing laundry. Maybe a sense of tightness in the chest or pressure in your shoulder creeps in. The night before, you might toss and turn, sweating, or feeling unusually anxious. These signs are your early warning system. The heart is struggling, but still has a chance to be saved. So what do you do if you suspect you're at risk? First, don't wait for classic chest pain. Many heart attacks occur without dramatic pain. Second, don't try to tough it out or sleep it off. And third, don't drive yourself to the hospital. Call emergency services. Minutes matter. Next, ask for a high-sensitivity troponin blood test if you're at the ER. This test can detect very early heart damage, even when ECGs appear normal. You can also request an electrocardiogram, EKG, and speak up about all your symptoms, even if they seem vague. Medical professionals are trained to spot patterns, but only if they get the full picture. For prevention, there's also a powerful test that doesn't get enough attention: the coronary artery calcium scan, CAC scan. This CT scan shows whether you already have calcified plaque in your arteries, even if you have no symptoms. It's one of the best predictors of future heart events, and yet it's rarely ordered proactively. If you're over 45, especially with a family history, ask your doctor about it. Of course, recognizing early symptoms is only one part of the picture. You also need to reduce the risk of a heart attack happening in the first place. That means managing blood pressure, keeping LDL cholesterol low, staying physically active, reducing processed food, quitting smoking, managing blood sugar, and getting quality sleep. And there's one more tool that can help: tracking your heart rate variability, HRV, and resting heart rate using a wearable device. These numbers can detect when your body is under abnormal stress, even before you feel it. A sudden drop in HRV or spike in resting heart rate may indicate your nervous system is under pressure and can be a subtle sign of cardiovascular strain. Let's close with a powerful story. James, 59, had always been healthy. No major symptoms, no known issues. But 3 days before his heart attack, he felt more tired than usual. He had some jaw discomfort and trouble sleeping, but chalked it up to stress. The day before, he started sweating during a walk, something that had never happened before. That night, he felt a sense of dread. He went to the ER and told them everything. Troponin levels were elevated. Within hours, he was in the cath lab, where they found a 95% blockage in his left anterior descending artery. His decision to listen to those vague signs saved his life. The moral? Don't ignore your instincts. If something feels off, even if you're not in pain, trust your body. You know yourself better than anyone else. The signs may be subtle, but they are there. And now you know what to look for. This has been Heart Attack Awareness. Thank you for watching. Share this with someone you love. It may save their life. And please, subscribe if you haven't already. Stay informed. Stay alert. Stay alive.